Hi, I'm Dr. Fritz, and I'm going to do a demonstration of some of the uses of Manaka's hammer. So one thing that you can do, regardless of the age of the patient, if there's not anything in particular that you are treating, is the general health treatment. This usually takes about 20 minutes altogether, and it's just a series of tapping at no particular tempo throughout the body. So we're going to start, and you can follow along. Okay, so you're going to do 2 basic points. I usually use gallbladder 20 and 21 at the occiput and then at the shoulders, and then we're going to go down the spine. Again, the Manaka doesn't specify, but I usually use the bladder shoe points. Okay, so when you hold the needle, you're going to have the more tapered end against the skin or the body. You're going to hold it near the body, and the other fingers can kind of hold it next to the body. So we don't want to hold it up here, you don't want to hold it up by the edge, and then you're going to use the felted part of the hammer to strike the top of the larger part of the needle. Okay, so here we go. Then at the tops of the shoulders. And I'm holding this rather loose so it does reverberate a little bit. Okay, and then down, alternating sides of the spine. Okay, so that's the first part, and then you'd have your patient lay supine, so face up, if you can lay down. And Manaka created this to mimic some things that were done in imperial court, but also so that there wouldn't be any kind of fear about needles, and so you have the non-insertion techniques. So the next part that we're going to do is just tapping the same time 10 times along the costal ridges. Okay. Okay, and then you're going to go across the pubic symphysis. So sometimes, depending on the gender and the comfort level of the patient, I'll bring this up a little bit, but usually it's pretty comfortable. Okay, and then we're going to go down the Ren line, and I usually start at Ren 17 and go down to either Ren 6 or Ren 4. Again, it's not specific acupuncture points from Manaka, but that is what I do use. Is that feeling okay? Again, going to about the pubic symphysis or REN4. Then the next step is to go along the large muscles of the leg. So I usually just go straight down the quadriceps. Okay. Okay, and then finally we end with tapping the Jingwell points on the hands and the feet. And so I've noticed that this can be a little bit more tender with patience, and so you just adjust the hammering technique a little bit, but still holding it relatively loose. I'm just going to reach over. Normally I'd walk to the other side of the table. Does that feel different on your fingers? No, it feels okay. Okay. And then I'd proceed down to the toes and do the points there as well. So that is the general wellness treatment with the Yoshio Manaka's hammer. Thank you.